let's give a round of applause. He's leaving. Wasn't that wonderful? Thank you so much, Lily. Thank you, everyone, for coming out tonight. My name is Jan Bueller, and I work for the foundation. I've been here for about 3.5 years, and it's my absolute pleasure to see all of you here in person. This is so wonderful. It's just heartwarming. We have a very special afternoon set out for you, and I'll kind of give you an idea of what we're going to do. We're going to have our two Sarahs say a few words, and then we have a panel of our wonderful, wonderful people from the hospital. And we're going to do it in 3 sections. We're going to start, we're going to talk about what happened to the hospital when COVID hit, especially with acute care and long-term care. And then we're going to talk about its effects on our surgeries. And then we're going to talk about the future of the hospital. So we'll be encouraging, as you can see in the middle, there's a mic. And so there'll be time for questions if anyone has any. And we'll get started. So I'd like to introduce Sarah Bragg, our CEO and President. Sarah.
Hello everyone, this is my first in-person event, and I just wanted to say I'm really, really excited to see all of you here. I can't tell you how much it means to us that you'd come out on this very soggy day and join us for what I think is going to be a really interesting afternoon. The past couple of years have been challenging for all of us, but they've been especially challenging for fundraising organizations. Because of you, we have remained nimble. We have been able to continue our support of this amazing hospital that we all love. And we've been able to continue supporting healthcare in the community with our partnership with Shoreline Medical. This donor tea is a way of us giving back to you. We hope that you will ask your questions. I'm blown away to look down this table and see the leadership team from our hospital sitting here. It's truly remarkable that you would all give your time. We know you're busy, so we thank you so much for being here. We are joined by some of our volunteer board. Would you all please stand? I know you hate this, but please stand, and I would like to wave when I say your name. Please have a stand. So the lovely lady in stripes, Michelle Holmes. You all probably know Michelle. Thank you. You all know Sue Hodgson, who splits her busy days between Seaside and us. Our Vice Chair, Chris Straub at the back. A busy surgeon, Mick Brown, Dr. Mick Brown, who works out at Saanich Peninsula Hospital. And Ted, you're somewhere. I don't see you standing. Oh, and Ted Daly, who is there to keep us on the straight and narrow. Thank you all so much for the work you do for us. I also wanted to we have 2 volunteers in the room, Beverly and Barbara, who have worked tirelessly for years, for decades, on our newsletters. Please stand, both of you. Thank you so much. And last but not least, I'd like to introduce you to our staff, the staff of the foundation. You all know Jan, and I have to say Jan will be retiring next week, and we're all very sad to see her go, so please give her a real round of applause. So you'll gather now that Precis is the only remaining long-term staff member. Precis, take a stand wherever you are. Thank you so much. And we have 3 new people. Karina Adams, over, thanks Karina, and Karina will be moving summer student, Luke. So that's all of us. And you can imagine it's a pretty tiny team for the large amount of work that happens. So I just hope that you all enjoy this afternoon. We are very grateful to all of you, the leadership team, for being here, and we're most grateful to all of you for helping us do what we do every day. Thank you.
Thank you, Sarah. And now I'd like to introduce Sarah Crawford-Bowl. She's the Executive Director of Clinical Services Delivery at Island Health.
Well, thank you. Hi, everybody. Can you hear me okay? I'm a bit taller than sometimes. Nice to meet you all. My name is Sarah Crawford-Joel. I've got a very long title. I'll give it to you anyways, because it might be a bit boring to now, but it's the Executive Director responsible for community health services, community hospitals, primary care operations in the South Island and Southern Gulf Islands, and I also look after the laboratory island-wide. And nurse by background, I thought I'd start off by just telling you who I am, because I think it's really important for us to know who we are. And first of all, I guess I should say, let me acknowledge the traditional territory upon which we have the honor of meeting today, and that would be of the Saanich people of the Saanich, Sartlip, and Paquetchun First Nations. And it is absolutely an honor to work, live, and play here on this traditional territory, and we are most grateful for those families who have stewarded these lands for generations. So as a 14-year-old, I came up here from Calgary, Alberta, and landed on McTavish Road in North Saanich with my parents. My parents still live on McTavish, and they farm a 10-acre plot there. Not sure if you know the Roost, but that's where my parents live, not in the bakery itself, but on the land. And my husband and I had the honor of running that shop for 13 or so years until a couple of years back. I grew up running around the traffic bar from secondary school. I put up the wallpaper in the city subway in 1993. I folded too many jeans at the local Marksburg warehouse. It was called Workwear World then. And now my kids, they went to elementary at Qualsec, and now my littlest is graduating from there, and on she goes to the Bayside. Anyways, I think that what I wanted to talk to you a little bit about today is resiliency and the incredible people here who help to support us keeping that incredible hospital running, and not only the hospital but the surrounding community of health services, because we really try and integrate our health services as much as we can, knowing that people require care in different venues at different times, and when we are able to provide a seamless transition from one spot to the next, that is really when we have optimal care for the people we serve. So over the last couple of years, you can imagine we've had the pandemic. That's really what Sarah mentioned, but that was one piece of many, many challenges that we faced. We had allegations of racism in the press through Saanich Peninsula Emergency Department. It was a big hit for us. It's important for us to acknowledge that while several of the allegations were not seen to be founded, we know that systemic racism exists, and we know that we can be better. So that was a hard reality, a hard truth for us to face, and work being done to make sure that we make significant improvements. We also had environmental challenges, a heat dome. Many people from our community here coming in through the doors of the emergency department requiring care because they didn't have air conditioning in their homes. It exacerbated their COPD and CHF. It impacted significantly their ability to survive. In those 4 days, we saw many, many people come in struggling to save their lives, for us to try and save their lives, for them to keep going. We also had a massive flood. We almost had to evacuate Saanich Peninsula Hospital that day. We've never had to evacuate Saanich Peninsula Hospital. Most of us, incredible leaders that are beside here, we haven't had to do that before. And having maybe 4 hours to try and do it, we were said, oh, you got to get out in 4 hours. So we worked madly to try and figure out how we were going to move almost 200 long-term care patients, 65 acute care patients, an emergency room, an operating room, and all those patients that were coming in for outpatient services. How do we shift gears in 4 hours? We had to act quick. Luckily, bunch of fire department supports, local people with diggers and sandbags. Local farmers came out to help dig us out of that mess, and we managed to, they managed to save the day. So since that time, you'd think that we could just, get up, brush ourselves off, and carry on, but unfortunately that's just simply not the case. The ramifications of these last 2 years have had a significant impact on you, our community, and the staff and physicians and other care team members, volunteers that provide services at Saanich Peninsula and the surrounding area. So back to my point about resiliency, what helps us to move forward, to keep going, is absolutely critical that we keep going. We have this incredible community of people to support. So last week I had the opportunity of going to a quality, it was called a Quality Forum, really a conference. Like to Sarah's point, it was my first in-person conference in years as a result of this COVID business. And I had the opportunity of listening to an elder from a Coast Salish family, and she brought forward this concept of resiliency. She said, there are two main sources of resiliency, according to her and her people. And it was that one, we have to acknowledge the incredible territory on which we live. How do we respect it? How do we look after it? How do we pay tribute and acknowledge where we live so that we can do everything we can to keep it going forward? So that's, for me, that's how do we have a green plan for Saanich Peninsula Hospital and the surrounding area? How do we make sure that we are doing everything we can to reduce emissions, live sustainably, prevent the pollution? I mean, on it goes. There's many avenues, many opportunities for us to reduce our footprint. The next piece was around people. And really I want to say thank you to all of you and to our incredible team, because the people are what helped us get through these last almost 3 years. She talked a little bit about our elders and how important it is for us to share stories and to make sure we listen and take the learnings from what we hear. And so I think to many of you, who I see some of my dad's friends in here, Stacy really right age of 80. And he has so much to share, and I don't get enough time with him, but I think to all of you, what stories do you want to share with us that will help us to build the future of tomorrow? What do you think is important for us to know as leaders of today, so that when we're in your seats, we can look back and feel proud and honored for the work that we've done? I also think about resiliency in terms of how we can learn and grow from these last experiences together, because the youth of our neighborhood, so the demographics have changed immensely over the last almost 40 years that I've lived. Oh my gosh, 40 years, almost 40 years I've lived here. How do we learn from our youth? Because their needs are very different from my needs as a youth. I listen to my kids, and what they want for themselves is very different from what my parents want or what I want. So how do we listen to the community of those youth who will likely, in all likelihood, end up living and growing up here and raising their children? So I really thank you for being here today. I thank you for coming with your thoughts and ideas, questions, and the questions might put us in the hot seat. We welcome it. We welcome your feedback so that we can also help to grow from that. And know that this is an incredibly group of committed people, most of which live in the area. Those who don't wish they did. And we really want to do right by this community by coming up with a plan that is sustainable, that provides equitable access, culturally safe access to care when a community needs it, and in the best possible way. So I thank you very much for your time today, and I'll hand it over to Sarah and others for our next piece.
Thank you so much, Sarah. Okay, we're going to get into this now. I would like to start with the panel. We'll start with Michelle. Please introduce yourselves. Tell us what you do and maybe how long you've been and anything else you want to add.
These turned
Yep, you're on.
up. Hi, my name is Michelle Brownlee. I've grown up on the peninsula Peninsula. My family has been here since I think I was 6 months old, so we're a long-standing family. I come from my dad and my mom were the Carpots, and so we've lived here for years. I have worked at Saanich Peninsula Hospital for 32 years now. I volunteered there as a candy striper when it was just extended care with Kim Tidman. So, long history. What else can I tell you about myself? My whole family has been through the hospital. I had my first child there, and then, I don't talk about people a lot, so, and I have had all my grandparents and family, and my mom passed away a couple of years at the hospital. So I've seen it from all different directions, and it has been, this community has been a huge part of our life. And I'm quite proud to work at the hospital for all these years and to give back to the community. And it's quite interesting when I'm working and I run into people I know, grandparents, parents, people, friends, people I went to high school with, and it's just, it connects you even more. So the community is important, but the hospital is really important to me. It's a big part of my life. So that's that.
Good afternoon. I'm Dr. Alex Brothers. I'm the current Chief of Staff at the Saanich Peninsula Hospital. I took over that position September of 2021 at the coercion of one of my colleagues, Dr. Brandon Irvine. And I'm also the department head for emergency medicine at Saanich, and I'm newer to the community. I've been here since 2008. We moved here from Alberta with my family, and my children went to school in Saanich and started their first steps in university here, and then flew the coop. I just want to say that I've worked in a few hospitals across the country, and I have yet to see a hospital that functions the way that Saanich does for the community and the size of the community that they serve. And that's that we value family medicine and primary healthcare medicine in such a way that the hospital is virtually incapable of running without family physicians and primary healthcare. And I think, as you all know, primary healthcare is under siege across our country right now, and it's something that we have to pay attention to, and we as a hospital and as a foundation and as a community really need to start to focus in on if we hope to get through this crisis. Currently, we have one of the only models left in the country for the hospital of our size, where the community physicians also actively look after their own inpatients. And if you look at the other hospitals that are downtown or hospitals that are our size across the country, it's now been taken over by what's called the hospitalist program. And these are physicians who come in strictly to look after inpatients. And although we currently have a model that allows our community physicians to come in and do that type of work, we also value them working in the community, and we need to hold that value to the highest level, or we will not survive this crisis. And I think that the foundation is a key role in this. And I just have one last thing to say, and that's we're connected as communities across the country, but we also need to look after our own community and look after our own needs, and community solutions need to be a priority now in this situation. So I just want to thank you. And one last thing to say, Dr. Mick Brown taught me ATLS 26 years ago, which is Advanced Trauma Life Support, when I was a medical student. So.
I've worked in long-term care for 20 years. I started out as a healthcare worker at Rusthaven Lodge, which was really a pleasure too, keeping in the community. And this is exactly where I want to be at Saanich Peninsula Hospital. So I'm happy to be here, and just such a pleasure to work with such a great team, and happy to be here today. So thank you.
Good afternoon. My name is Erin Hole, and I'm pretty new to the Saanich Peninsula Hospital, and I've been in my role as site director for just over a year now. But I've been thrilled to join the team there, and I agree with what Alex has said. I've been a nurse since 1985 and worked in various hospitals back in Manitoba and here on the island, and I've never had such a community feel and such a family feeling when you walk onto the site. I'm really enjoying my role here, and I feel very privileged to be at Saanich Peninsula Hospital, and thank you for having me here today.
Good afternoon. I'm Brendan Irvine, and I'm the medical director for Saanich Peninsula and the Gulf Island areas, and have been for the last 3 years. I had pretty big shoes to fill when Ambrose tapped me on the shoulder 3 years ago and said, "Brendan, we really need you to help at the hospital." And I'd already been helping at the hospital, I thought, because I'd worked at the Emerge, and I have worked at the Emerge for 20 years now, and was site lead for the Emerge for about 15 of those. So it's been a challenging time, as has been alluded to. We've all experienced trauma. There's no question. COVID has put a massive trauma. It's somewhat disproportionate in different areas, and we do need to recognize that the privilege we have of working and being able to help others, it is exactly that. It's a privilege. And it's from cooperation of everyone involved, fundraisers, foundations that are behind us, our staff that are working sometimes more than they should, coming together and problem solving. We did that throughout COVID. We met every day with, we're part of a bigger system. We have Island Health and we have Provincial League, and we met daily to problem solve, which we've done. And we're here, we're alive, and we're working hard to improve things. I have to say, 6 years ago was a critical point for the foundation to start to get involved in community and supporting resiliency in doctors and offices around the region for primary care. And they've done an excellent job in that. It has been a struggle because there's been big changes that, 30 years ago, for example, when I came to look for work here in Sydney, there was more doctors than there were patients. So they were saying to doctors at that point, maybe you should look somewhere else. So it's been a huge shift, 30 years. That's my working career. Now, policy changes are coming. We're seeing cooperation from the Ministry of Health, which I haven't seen in the 3 years that I've been doing this job. They're open, they're changing as quickly as they can, they're pivoting, and we're creating different opportunities, such as the foundation saw 6 years ago to help support clinics and make them function as optimally as they can. In the department, we appreciated all the support of the foundation whenever we needed a new piece of equipment or N95 masks that weren't readily available. We were able to garner the support by asking the foundation and saying, hey, this isn't on our purchase list, but we really need it now, and it happened. We really appreciate that. And as mentioned, the meals and the teas, the spirit building events, we're going to have a food truck come out for the staff this month, and just give a little bit of a thank you in different ways. We used to have a barbecue. Hopefully we'll get that going again soon as well. it's all very much appreciated, and your work and your dedication to the foundation and the hospital is very much appreciated.
So hello everybody, my name is Jessica Johnson. I work in partnership with Dr. Brendan Irvine, and I feel very honoured to be able to do so. So my role is the Clinical Services Director for the Saanich Peninsula and the Southern Gulf Islands. By way of background, I too started out as a nurse, and you can probably tell from my accent that I started that career back in the United Kingdom. 10 years ago, I had the opportunity to move here to Canada, and it's been an amazing experience. And I was able to start my career for Island Health. 3 years ago, I made a decision to move here and to work at Saanich Peninsula Hospital. And like Erin, I really, it's hard to put into words, but when we've worked in large tertiary hospitals, community centres, small unique sites, and then we come to Saanich Peninsula Hospital, the only way I can describe it is I feel like I came home. And I say that because the sense of community is so important. The sense of camaraderie amongst our teams, amongst our physicians, and our relationship with the communities that rely on our services is like no other. And long may that continue. I wanted to take the opportunity just to say that we're going to hear some stories about what the last few years have been like working within the hospital and within the community, and you've all lived that experience alongside us. But I know I'm speaking on behalf of everybody at this table when I say it is such an honour to be able to meet you, to look you in the eye and tell you that there is no way that we could have got through these last few years without your support. And we didn't get the opportunity to see one another, right? Maybe a few Zoom calls here and there. But the fact that we get this opportunity to meet you, to speak with you, to share with you some of our experience is very humbling and truly an honour. Because, as I say, we couldn't have done it without you. There's the monetary aspect in terms of equipment that you supported us with, and of course that's so important. But what I would really say is that I knew that this community had our back, right? Just as we were here to support the community supported us. So whether that was masks, whether that was OR equipment, whether that was the delivery of we have water bottles. My goodness, like just getting through our working day was tough, and having a water bottle that was unique to each individual staff member when we were so nervous about being in groups together. Small things like that absolutely went a long way, and so we are so incredibly grateful to you, and I really hope we get a chance afterwards just to speak one-on-one with some of you, because truly appreciative. Thank you.
Hello everybody, I'm Carrie, and I am acting manager right now of the Saanich Peninsula Hospital Surgical Services Departments, and I took over from my predecessor Troy Corville in November of last year, and so I'm fairly new to this kind of role. I haven't done before, but a little bit about myself. I've been nursing for 17 years. I started my career in Calgary, and I worked there many surgical floors, surgical daycares, finally into the cath lab before moving out to Victoria for a better work-life balance than being in the big city. I grew up in a very small town in the Crow's Nest Pass in deep southern Alberta, very close to Fernie. And I prefer the small community feel, and that's what the Peninsula gives me, and this is what Saanich Peninsula Hospital gives me. It's very much like my hometown hospital, and I feel that the community that a hospital like this brings a better, safer work-life balance with more support, more camaraderie, a family-based atmosphere, and people who you work with and care for that generally care back. Genuinely. That's what's important. And I think that it's very important provide the best care. And for me, that's at Saanich Peninsula Hospital. And right now, leading surgical services through whole new areas and grounds and taking it to places that it hasn't seen before. So thank you.
Thank you, everybody. That's wonderful. So we're going to start where it began. We remember when we all heard the news. The hospital closed its doors. Us at the foundation all had to start working from home. We all isolated. What was it like there? I know, Michelle, you had notes that you shouldn't show us, so I'm going to start with you. In acute care, like, tell us about what it was like for you, for the staff there. Over to you.
So, as a nurse educator, I'm on the floor every day, and quite often taking patient loads as well, due to the nursing shortage. So, working side by side with all the nurses, it was an extremely stressful time for everybody. Even hourly, things were changing for us at the hospital. So, we would be told to look for certain symptoms in our patients, and then a couple hours later, they would say, there's another symptom to keep your eye out for. And so working in that environment makes you quite anxious, and then because you're worried that your patients could possibly have COVID, and then you're also worried about the other patients in the rooms, and then you still have visitors coming in and out. So when we locked down, that was really hard. We had a lot of patients that have dementia, a lot of elderly, frail seniors, people with mental health issues, and having to deny people that contact with even nurses, let alone their families and their friends, was really stressful on the patients, stressful on the families, and really heartbreaking for the nurses on the units. They found it very hard to say, sorry, you can't come in. Sorry, I know you came in 2 hours ago and you're coming back for dinner, but in the meantime, your family member has showed some symptoms. We've had to test them, and until we get results back, we can't let anybody in. That's heartbreaking for a nurse to have to do that. As well, just the changing of our protocols was happening on an ongoing basis. Like, you would come to work one day, the next day it would be beefed up a little bit more, because as we realized how fast and virulent the COVID was, we were having to change our practice. The lockdown created, in some ways, we slowly had less and less patients because people were discharged, moved to the bigger sites if they were positive. It was a haunting experience to work in a hospital when it was emptying out. It really was a strange and scary feeling for most of the nurses. Like isolating patients that are confused and sort of segregating them from other people was really difficult as well, because for someone who doesn't understand what's going on, it just feels inhumane to have to do that. For nurses, also a lot of fear around going home, taking it to their families, to their kids, to their parents, to anybody who was compromised in their homes, was a big fear. And for the ones that needed to isolate, the foundation helped out with staying in a hotel so that they felt at least safer, so that they weren't going to take something home to their families and enable them to continue working. But at the same time, that caused other issues, right? Isolation for nurses. We didn't have our same supports. We didn't have our same outlets that we normally have to deal with the stresses of the job. Like the rest of the community, everybody was experiencing that isolation, which was extremely hard on everybody in the hospital as well. Multiple testings when we had the outbreak. We were being tested at least twice a week. For the nurses, that we'd have to go get tested, and every week you were wondering if you were going to show up positive. Even though you wore all your PPE and you did everything you thought was correct, it was another stressor that was added on the job. Visitor, although we did allow some visitors in, essential visitors, it was great to have them in, but at the same time created another task for the nurses to learn how to teach the public to wear the proper PPE, how to don it and doff it, so put it on, take it off without contaminating themselves or spreading it to somebody else in the hospital. So those were all challenges that we came to work with every day, and we made it through. We're still in COVID, but we definitely feel that we know how to manage it a lot better now, and that we realize that it's going to be here for a while. And did you want me to talk about that?
That's great. Stephanie, during the lockdown, well, both departments, you had people that were organizing window visits and tablets and phones and stuff like that. Tell us about how that works, and you lovely donors provided that for us.
Yeah.
Tell us about that.
Absolutely. Thank you all so much for your support with the tablets, with the virtual visits, and the window visits, having the awnings built, and modifying the garden to make it so we could have more visitors was fantastic. To protect the greeters and the receptionists, you guys very generously donated all the supplies for that, so thank you. It was scary. It was a scary time, really, and you summed it up beautifully, Michelle. It was stressful times and confusing too, because 1 minute we'd be open for visits, and the next minute we weren't, and then, the rules changed, mask on, mask off, families, and, it caused a lot of frustrations for the families and stress on the staff, so we appreciated all their patience when they had it with us, and, it was just so generous of you guys to be supporting us, and we really felt it, so thank you all so much, and the treats and all that special treats and foods was really, we really felt the support, so thank you. It was not a very fun time. But I feel like we're, seeing the light, and things feel like they're changing now, so.
And if I could chime in, isolation is over. Pretty much, there's no visitor restrictions. Pancakes, ER Infectious Disease League has said the vaccines have protected us from severe disease, and those who've had it now have even more immunity if they suffer from COVID. So we're getting to a point of learning to live with COVID, and hopefully we'll have a new round of vaccines which are a little bit more sophisticated against Omicron, and then continue to protect the population. We still do have a number of people in hospital with COVID, however, they're there for other reasons. We have a huge surgical backlog, and if it weren't for the foundation, our surgery wouldn't be able to ramp up the way it has. We've got the third OR that was very foresightful of the foundation to know that needed a renovation and addition, and the third OR is now running full steam, and Carrie could talk more to that, but there's all these downstream effects that we're seeing, and we have to accommodate for, but it is sure nice to know that isolation, visitor restrictions are kind of a thing of the past, but you can tell it's left a little bit of a scar on everybody, and for those families that lost loved ones during isolation, just unimaginable and difficult time, but know that we're at an end of that time, and hopefully we'll open with in-person meetings and a more sustained level of immunity to COVID.
That was a beautiful segue into talking about surgery. Carrie, do you want to go ahead there?
Make sure everybody can hear me. So as everybody knows, especially from all the news that was about for the surgical slowdown, where we canceled a lot of the surgeries that Island Health was able to perform so that we could create more room for potential COVID positive patients that needed hospitalizations. That really shook the ORs, including I was in PGH when that first initiative went down, and to redeploy all of our staff to other wards that didn't actually have any COVID patients yet was a very stressful time because everybody was waiting with bated breath. When was our first COVID patients going to start rolling in? How sick were they going to be? How bad was the pandemic going to hit us? So that was an extremely stressful time for all of the OR staff to retrain, to relearn some new areas, and wait for what they didn't know was going to come in. So make a long story short, we've moved on past that period of time, and we went into what's a ramp up, meaning that we needed to actually catch up on a lot of those surgeries that were canceled, and there were a lot canceled, and it was really hard on families and patients who had made plans over the last few years that they've been waiting to have their surgery to now have to wait even longer. So in that, SPH was looked at as a place that, hey, we could really utilize the OR space much more efficiently. So the efficiency initiative was coordinated previously by my predecessor, Troy Corville, who looked at what we had in the OR currently and thought, where could we make it more efficient? Where could we pick up the slack? And so on his behalf, we saw our OR percentages increase by 130 to 150% over previous pandemic surgery numbers. He coordinated an absolutely amazing, efficient operating room with what we had. So now moving forward, that poor guy has retired now because of that. He worked very hard. Our ability to increase efficiency was possible by the latest and greatest OR equipment purchased by you, our generous donors. This equipment expedites surgical procedures by allowing surgeons to complete tasks in a timely manner and with accuracy, thus increasing patient safety and meaning better patient outcomes. Our women's health program, spearheaded by the use of NovaSure, MomSure, and the fluid management system for hysteroscopies and endometrial ablations, has resulted in a significant reduction in surgical complications. The outcomes for these patients was so positive. Other sites have adopted the system or are in the process of adopting and updating their system to the system that SPH, Saanich Peninsula Hospital, initially started using on the island. We were the only site, and that was because the donors of the foundation provided us with state-of-the-art equipment, and our ladies had the best care absolutely possible for them, and that has been shown in excellent post-operative numbers. So we're seeing that across the island, which is fantastic. And then recently, SPH Surgical Services was able to purchase a new ultrasound machine. I would like to share a positive story about how that new ultrasound machine impacted and improved one of our patient journeys, and we just got this 3 weeks ago. Our patient had a gynae surgery that required extra pain management. As different pain relief modalities were not sufficient enough, and because we had our brand new ultrasound, our anesthesiologist was able to offer this patient a freezing block and delivered it with such clarity and accuracy that subsequent pain medicine requirements were drastically reduced. The patient was discharged on schedule without complications, and this could not have been done had we not had the option of being able to provide an alternate method of pain management for this patient. This patient had an excellent outcome, told us afterward what a fantastic experience they had while in hospital, and their recovery has been going on without a hitch. And we're about 3 weeks post-operative for this patient, and that's because of the donors providing us with this ultrasound machine. It would have been on the list for a very long time had this not happened, so very timely for our patients. So what is coming in the future? We are opening up the surgical time in ORs to accommodate more surgery at SPH, as Dr. Irvine has mentioned. Yeah, we have OR 3. OR 3 is getting up and busy, and we are on the road to ramping up even more. Wednesdays and Thursdays, we're hoping to reduce the ever-growing surgical waitlist by adding more surgical patients. We anticipate a continued expansion as there is an increased demand for healthcare services, and we've also hired our very first anesthesia assistant respiratory therapist. This allows our surgical program to take on more complex surgical cases and thereby reducing health waitlists. And our brand new surgical daycare department has been open for almost a year The new surgical daycare space provides the ability to serve more patients and provide surgical and endoscopy beds pre and post procedure. And the space has also provided our site the opportunity to create an outpatient antimicrobial therapy program, as well as support a medical ambulatory program, allowing more patients to be seen in a more appropriate area and hopefully reduce the number of patients going through our emergency department so that the emergency cases that do show up there are being seen by the appropriate people. The growth of the surgical services portfolio has been immense through COVID. For SPH, the adversity we faced at the start of the pandemic has led to a positive program change. This is due to many factors. Our incredible hardworking staff is at the forefront of this effort. However, the improved efficiency of the equipment purchased by you, as well as your ongoing support, has made SPH Surgical Services an even better center of excellence. So thank you.
Wow, that's just amazing. So I have a question for any of you who would like to answer. So during all of this that you all went through, what would you say was your biggest challenge, and what was this you say was the thing that got you through and kept your spirits? Anyone? It's tough. I mean, I just threw it at you, sorry.
I think Michelle's referred to it already, but I think one of the biggest challenges is that the coronavirus was new to all of us, right? So we were dealing with the great unknown, and the pace of change was so fast. So we were continuously advising our staff, changing our patient flow programs, and then we would learn more, and then we would change again. I know lots of people kind of made the joke that during the COVID years, the term that we use all the time is pivot. And I would say that that's what we did. We pivoted multiple times in 1 hour, multiple times in a day, multiple times in a week. I've always found working in large organizations that we talk about implementing change, and it's like trying to turn, a dinosaur around. It takes so long to implement change in big bureaucratic organizations. Well, it's amazing what you can do during a pandemic. And so some of those changes were supersonic in terms of speed. So I would say that was one of the biggest challenges. And in terms of what was one of the biggest lessons learned and improvements is it's amazing what you can do, right? And that's what I was referencing earlier in the introductions. It's amazing what you can do with a great team spirit. It's amazing what you can do when you know you've got your community behind you. It's amazing what you can do when donors such as yourselves almost preempted. We didn't need to ask. Sometimes you were there beforehand. I think about the surgical daycare renovation that Carrie made reference to. My goodness, we were able to do that because of the donations that we received through you. And there is no way that we could have slowed down our surgical program and then ramped it up at the speed that Carrie's talked about without having pursued that renovation in spite of a pandemic. So many building changes were stopped during the pandemic, but we were determined. We could see light at the end of the tunnel. We wanted to move forward with that work. I'm grateful to Dr. Brown for helping to facilitate that work with us. And because of that amazing facility, that I find it hard to even reconcile that we got it done on time and under budget. Again, during pandemic times, but again, it's amazing what you can do with that support. So I would just want to share how amazing that work was.
I'm just going to echo a little bit about what Jessica said. I'm going to come from the emergency department, because really that's where the front line was for not only our community, but for every community across Canada. And it was the unknown to a certain degree. Those of us who've been in practice for a number of decades understood what the severity of this could have meant, because we had lived through the SARS scare, where it wasn't as spreadable, but it was more deadly. and it was the same virus that was coming at us. And so I think what the major impact on our staff was the unknown. Were we putting our own lives at risk? And definitely we were. And we did that out of support for the community and out of a sense of duty. And we had very good leadership, not only in Saanich, but in Island Health and provincially, and indeed nationally through this. We had very good guidance in retrospect. At the time when it was happening, of course, there was always questions that are raised. But I think that our leaders, not only politically, but from an administrative standpoint and from a medical expertise standpoint, had this thing nailed. And I think that once we walk through this, we are prepared now, not only for what's to come in the future, but also we're better prepared to understand and know what infectious diseases can potentially have as an impact on our society and our hospital. And we've come up with, some of these guidelines that we've come up with through COVID are going to remain with us and should remain with us. They're protective, they save lives, they save workers' lives, they save patient lives. And so that's one of the positive things that's come out of this. I will say that you have a great medical staff, you have a great support medical staff, right from the people who clean the hospital to those who porter people to x-ray, to nursing staff in particular, and to the physician staff who all basically stood up during this time and did what we needed to do. And I also think we have a great administrative staff that helped us through this.
Thank you. So I know you've touched a bit on the future, and before I open it up to questions, if anyone has any questions, some of you have talked about it. Is there anything more you'd like to add about what you see the future of healthcare, the future of Saanich and Sarah?
You know, I think a couple of things come to mind. One thing is our human resource gap and how we fill it. And I was up in an IMO and there was a sign in the hotel room that said, "The world is short-staffed, thank you for your patience." And I thought, oh my gosh, isn't that the truth? Through COVID, it was an opportunity for people to check in about their career choices. Maybe this is an opportunity to retire. People who had pushed retirement back a bit thought, okay, no, that's enough. That it's time to go. I'm not willing to risk my life to continue to work past my best before date. And then there were the young people who were newly graduated and thought, what have I done? Why have I chosen this career? And you know, I look back at this experience, and like many of my colleagues had mentioned, you know, as hard as it was such an inspiring time. I'm so honored to be part of this career, healthcare. It's such an honor to be a part of, you know, from birth to death and everything in between, and to be there for people during some of their toughest moments. That's why I went into nursing. So for me, I think our future has to start with our people and how we make this a great place to work, a great place to learn, and a place that's a magnet hospital to work in. And this team is a magnet. As we've all said, this is why we're here, why we stay working in this environment is because of the people, the incredible community we serve, the foundation, and all of you donors who take this very serious protection of this hospital, support of the hospital, and the future of the hospital very seriously. So I think that's number one, is how do we make this a great place for our people so that we keep the people? Retention has got to be the number one, and how we continue to recruit people. And we might have to steal from Alberta, but that's okay. But I do think we need to find those creative ways of bringing people in. The next one is how Carrie mentioned about the surgical backlog. People, you know, and when Jay asked the question around, you know, the toughest part, to be honest, I'm kind of feeling like that's now. People coming through the emergency doors, we've got more people coming through the emergency doors now than we have in the past, in quite high numbers. A lot of those patients are seeking primary care, so we need to figure out creative ways of supporting primary care so that we can decrease the pressure on our emergency department. We have to think about how we support the patients who have not had their surgeries and the patients who did not seek care through the pandemic, mostly because they were frightened to come to the emergency department. I remember a fellow who came through our doors with a fractured hip that had been fractured for almost 3 weeks while we laid on his floor in his living room. He was frightened to death of coming into the hospital. And that's when he screamed at the paramedics, "Don't take me there, that I will die there." And it was just, he was so frightened of being exposed to the virus. So he was not alone, and this has been the reality across the world of people postponing care because they were frightened and or couldn't get access to it. So for us, by postponing surgeries, we know that we have a lot of catch up to do. And if we as a hospital can support some surgeries that we haven't been able to support in the past, with different equipment, with more electricity, Sarah Bryan can tell us more about that. It's amazing what barriers can get in the way. But I think that we have the opportunity to support getting people through and getting their surgeries now so that they don't wait any longer. I think we also have to think about expectations of the community and how we respond to population growth and the changing dynamics of the population. That, with BC, specifically parts of the island having the number 2 and number 3 fastest growing communities in British Columbia, we need to think differently about how we support a growing population. And we need any planners, city planners out here, we need to talk about how we embed healthcare planning in city planning. I know North Saanich has just gone through a community plan process, Central Saanich, the same thing. We have an opportunity to embed ourselves differently in our communities so that healthcare planning is really at the forefront, so that we have the services available when they're needed. Say yes?
I think one of the biggest challenges that we're facing nationally is the collapse of primary health care. And unfortunately, it's hitting us very hard in Victoria, and it's hitting us across the country. And I want to say again that our hospital seems to be one of the bastions of trying to protect primary health care. And I think unless we start to stand up as communities and support primary health care, that we're going to end up with a collapsing system across the country. And all we need to do is look at what countries are ahead of us in providing health care from the World Health Organization. Almost every country that's ahead of us places a priority on primary health care. And I don't want to paint a bleak picture here, but as an emergency physician, I see approximately 40% of people that do not have a family doctor. And that's a scary proposition, because people don't know what's going to happen to them in the community, and they're afraid. And we're afraid as practitioners because we can end up changing the course of their medical history and changing the course of their medical direction without any understanding of what's going to happen to them in the community. And I think that we need to start to come up with community solutions to avert a major crisis. And one of those things is supporting family physicians through the hospital, through the foundation, and through the community. We need to come up with new ideas, because what's happening right in front of us right now is a tidal wave. And unless we start to deal with it, and unless we start knocking on the doors of our politicians, and unless we start coming up with community solutions, this is only getting worse. And as Sarah mentioned, we're seeing a huge number of people coming through our emergency doors that we haven't in the past for basically primary health care because they don't know where else to go. And we are not good at providing primary health care. It's not what we're designed for. And what the system is designed for in our country is a robust primary health care system that is falling apart underneath our feet. And this needs to be translated to the people who can change it. And that's to our politicians. But at the same time, we can do things within our own community to bolster and support it and make it a place where family physicians and nurse practitioners and nurses want to come and work because we value it and we need to value it. And that's a direction that is far more important than COVID or any pandemic that's coming towards us. We see things in the emergency department that we should not be seeing. And we see things and we see people suffering, people dying from things that should not be even on the table. I don't want to sound bleak, but it's where we're headed. And I think with the support of the foundation, we can create an environment in our own community to start to solve some of these issues.
Yeah. I kind of had a similar message, and I ran it by my wife.
I didn't run that by my wife.
She said, Brendan, everyone knows that we're in a tough situation, but we're well positioned, and we have opportunity. Wherever there's change, there's opportunity. And so we are seeing new models of care provision. The OPAC clinic decanting some of our emerge patients, and it's a big number. Skin and soft tissue problems used to be the number one presenting reason to the emerge. It's now number 4 because the infectious disease experts are seeing those infections in the clinic avenues in the surgical daycare. There's also a hospital at home model that's maybe an option for us here on the peninsula. It's working in an award-winning program at Big General and Jubilee. So there's some things that we do need to pivot. We need to be responsive. But fortunately, our engagement of our medical staff, nurses, and other staff around our hospital is at a very high level. We all want to solve the problems that are presented in front of us. And I think we're getting there. We've had more cooperation from the ministry with our patient care network. There's lots of acronyms for different programs and funding, but that's one that's putting more resources into primary care clinics and looking at new contracts and alternate ways to pay nurse practitioners and family practitioners to keep them in our neighborhood. But I agree with Sarah, retention and recruitment is so important. But when I think of my choice in healthcare, 30 years ago there was strikes and Jackman Road and all the IWA were out, and I thought, well, where would a good place to be that gave me good job security? And I couldn't imagine that it would be this secure in healthcare. But it's such important work, and it's unfortunate that I've met and heard some younger staff disappointed in their career choice. But there's no more important opportunity than helping someone through a health problem or any kind of support that we see that's not directly in patient care, translating benefits that other people have had to help improve programs such as our donors are doing is another very worthy, and it should fill your heart to know that those funds are going to good programs and good improvement.
Great. So I would like to open it up to you. There's a mic, or you can stand up. Go ahead.
What do you think the number one problem is with medical staff in British Columbia? Number one, we hear out here in the community that doctors are not paid enough, so they're not coming
physicians, but also nursing has been undervalued. You can say it's a level of income, or you can say it's support. It's definitely been undervalued. We're currently facing a significant nursing shortage across the country, and probably even internationally. New grads from medical schools are veering away from family practice. It's not necessarily because of I don't think it's because of income necessarily. I think it's because they've felt they've been left out of the system. And we really need to bring that back into the system. And we can do that with innovative projects and within our own community in support of foundations. I don't think there's much we can do about the cost of housing. It is a social problem, for sure. It's hard to hear that nurses can't stay here or don't want to stay here because they can't afford to stay here. And now that's trickled down into new family physicians. I mean, you just have to imagine that you come out of a long educational process and you have a significant debt load just from that, and now you're facing basically $1 million to get into a market. And it's daunting for sure, but it's also universal. And so I think that we need to find ways to recruit people and retain people based on programs we have, and then how we can support it.
I think I'd also add, many of us are part of what's called the Partner Care Network, where we work with our local divisions of family practice to identify opportunities for increasing attachment for patients to a longitudinal care provider or family doctor. And what we hear is that, to your point about compensation, it's really outdated compensation models. That documentation requirements have changed so dramatically. You can tell me if I've got this wrong, guys, but documentation requirements have changed so much that almost 40% of a physician's day can just in the documentation, and those things that are not in front of a patient, and yet they're paid for the in front of a patient time, not that other stuff. So it can feel like you're doing a lot of volunteer work. And then the other bit is overhead, and that's a big one for us, with North Saanich being an area where it's the highest cost per acre, the land is very, very expensive. So to try and lease or own a property to run a business out of is very, very costly. So in the end, I think we hear those are the two major concerns. Sorry, there's another hand.
Judy, did you have a question?
Yes, thank you. There is a lot of experience and knowledge and brain power up there on this channel. And I would like to ask you, Doctor, you mentioned we need to invent innovative projects within our community. Could you please give me an example of what that might be? Because I don't have a clue.
Well,
And I'd like to know what direction to set my mind.
well, it's interesting, and Sarah and I have talked about this in our brief couple of meetings we've had together, and this Sarah has mentioned the cost of overhead is prohibitive to run a family practice almost in certain places in Canada, and Saanich being one of those. But we've talked about, for years, we've talked about creating a primary health care campus at the Saanich Peninsula Hospital. And I think that vision needs to be back on the table, and for us to look at that in the long term. It'll be a place where we can invite new family physicians to come and work, to be attached to the hospital, to be providing full scope family practice, and a place where we can look at different funding models and how we can pay them differently. And I think that would be one hard thing that we can start to look at. There needs to be a multi-pronged approach to that. There can't be just one vision, because otherwise we won't catch everything. I think looking at how we as a community through community politics, through provincial politics, how we can adapt to the change in our social structure and how we can provide primary health care. But I think we need to start to look at supporting primary health care, not only from bricks and mortars, but from how we distribute funds to them.
I can throw an example that's happening over on Salt Spring Island. The foundation there bought an inn and is converting the inn into about 20 suites for healthcare workers to be able to live. It'll be completed within the year. Thinking of our green plan for our hospital and area, maybe a fleet of electric vehicles for our healthcare workers to get around in would be an attraction, especially with the price of gas lately. Ideas like that that can be brought up at the grassroots and brought forward. We do need to come up with concrete plans to improve retention and recruitment and keep our staff and patients served well here.
May I ask who drives the wagon? Who does this?
We have input at the executive level. Sarah from Island Health, I would say one of the biggest drivers over my experience at Saanich Peninsula in the last 20 years has been the foundation. By creating opportunities, by building things that are needed, and then presenting it. It has to have the approval and cooperation because we're part of a big system, and operational funds need to be distributed where they're needed most. There's maybe Sarah would like to speak more to that.
I think Brendan's got it, and even Sarah and I, we meet for coffee every now and again. I give her a little nudge, meet with the CEO. So you know what she did yesterday? She went and met with our Island Health CEO to tell her about the incredible donors we have and how we have a passionate donor and community population that are willing and innovative and courageous, aggressive even, willing to do something new and bold. So I think that it's about us establishing the need. What do we need? So there's so many things we could do. Obviously, it's not an unlimited amount of funds that we have access to. But when we identify what the need is, and we do have planners and even just from the front line, our staff tell us all the time, this is what we need. Carrie works with a great team on the surgical side that they're able to say, hey, if we had this, then we could do this. So there's a lot of dreaming that goes on, but like Brendan said, because we have this influential foundation, we're able to say we have this idea and we have the backing. Because in terms of provincially, the money that supports building renovations, it's not huge, and so we do have to look across the health authority and say where do we prioritize that money. I remember battling it out, some doors for the emergency department that we critically needed versus a health unit in Taxis that had rats eating at the underneath part of the nursing station. I had to say, oh gosh, give it to the nursing station, versus us fixing some emergency doors. So there's a lot of need across the island, but when we have foundation support to do something creative and innovative, if it's earmarked for Saanich Peninsula, we're able to say, okay, we're going to move forward with that. That answers your question. And I'm sorry to say I have to run because I have an appointment with my own family doctor. As you know, that's precious and I can't miss it. So I'm going to leave you all with this incredible group and just say thank you so much for this time. Thank you for everything you do. So many familiar faces and so many people that I know work very hard to be able to provide the funds that the foundation needs in order to support us. So thank you for your innovative ideas and your courage and most certainly for your backing. As mentioned many times, we just couldn't do it without you. We can't do it without you. So thank you very much.
Are there any more questions? Barbara, and then there's the lady at the back.
my elder daughter's nurse, and I said to her one evening, why are you staying here in this small little hospital when you could be up the ladder if you went to BGH or the Jubilee? And she said, I stay here because everybody knows us. We are known by name, and it's a wonderful place to work. So if you're feeling a little bit down, would you please go back, give whoever you're allowed to give a hug, and say it's a wonderful place in which to work.
My question is naive enough, but if there were a requirement that foreign students who graduate medical school in this province be required to practice here for a length of time, would that provide any relief to our system?
Yeah, I think we have to move that political dial at the College of Physicians and Surgeons of BC. They've been very restrictive in allowing physicians to practice who are trained even outside of BC, which Canada-wide medical schools are excellent in residency programs, and the ones returning from foreign schools often are, brought up here in Canada and want to serve their communities of origin, and there's a lot of difficulty. We talked to Alberta physicians just coming across that little mountain divide between us and Alberta is difficult, which it shouldn't be. So, that's a political pressure that we could all put on our regulatory body, and that's the BC College of Physicians and Surgeons. They need to move that dial.
Any other questions? No? Well, I would like to thank all of you guys so much for coming and spending the afternoon with us all. And on behalf of the foundation, I'd like to thank all of you for making all of this possible. You all make a difference. It's just amazing. And this has been a lovely, lovely afternoon. I hope you've enjoyed yourself. The panel will come down and you can talk to them on your own. So a round of applause for everybody.